Cleansing bed bath procedures. First, greet the patient and then explain the procedure to the patient. Next, prepare the equipments needed for the procedure. We have there 2 basins with water, 2 washcloth, one for the face and then one for the body. Then we have their bath towels, clean gown or pajama, linen as needed. And then we also have their comb or hairbrush. And then hygienic supplies such as alcohol, lotion, powder, or deodorant. Then we also have their table protector, and then disposable gloves, and then soap dish with bath soap. Loosen the top sheet at the foot part of the bed. Assist the patient to move the side of the bed near the healthcare provider or the caregiver. Next, remove clothing under the cover of the top sheet, and then place soiled gown or pajama at the head part of the bed. Spread bath towel folded crosswise under the patient's head with or without pillow. Next, wet washcloth in the basin with water and then squeeze excess water. Wrap the washcloth around the palm, forming a mitten. Next, clean the eyes from inner canthus to the outer canthus, starting from the farther side to the nearer side. So this is to prevent water from entering into the nasolacrimal duct. Then rinse both eyes, same manner of cleaning it. Next, apply soap to the mitted hand and clean starting from the farther forehead to the face and then the ears, imitating the letter CSC. Then repeat the procedure on the nearer side of the face. Next, we need to rinse and pat dry. Again, apply soap to the mitted hand and clean patient's neck from farther side to the nearer side. Then after that, you rinse and then pat dry it after. Remove the towel at the patient's head and then spread the bath towel lengthwise under the farther upper extremity. Next, wash the patient's hand by soaking them in the basin, paying particular attention to the spaces between the fingers. And then after that, you rinse and then pat dry it. Next, soap the farther upper extremity from the distal portion to the proximal portion. Use long firm stroke. So long firm stroke is to promote venous blood return and circulation. After doing that, rinse and pat dry. Next, you expose the patient's axilla. Soap, rinse, and dry using downward stroke. So after cleaning the farther side of the upper extremity, repeat the procedure on the near side of the upper extremity. Next, you spread the bath towel crosswise over the chest and the abdomen of the patient. Patient's farther hand must be holding the upper edge of the towel and the near hand holding the lower edge of the bath towel. Soap the chest and abdomen using long firm stroke. Again, this is to promote venous blood return and circulation. For female patient, move mitted hand down to the center of the chest and around the breast in circular motion from bottom going upward. And for the male patient, use long smooth stroke from the farther side of the chest and abdomen to the nearer side. Lastly, rinse and dry chest and abdomen using patting motion. Next, turn patient to side away from healthcare provider or the caregiver, or back part facing the caregiver. Then expose the entire back of the patient, and proper draping should be observed. Then spread the bath towel lengthwise along the side of the back and the buttocks. Soap the back starting from the nape of the neck going down to the lower back, including the buttocks in a circular motion. Then rinse and pat the dry entire back up to the buttocks. Next, expose the farther lower extremity and observe proper draping. Spread bath towel lengthwise and flex the patient's farther knee. Then soap and rinse farther lower extremity using long, smooth, firm stroke from the ankle to the knee, up to the thigh, giving particular attention to the inguinal and popliteal area. Next, straighten the lower extremity, wrap with bath towel and pat to dry. Next, flex both knees and drape. Spread the bath towel crosswise under the feet. Place the basin on the bath towel. Soak farther foot first. Soap foot, paying particular attention between the toes. Then after that, rinse and dry. After doing that on the farther foot, do the same on the nearer side of the foot. Lastly, put on patient's new clean gown or pajama and then make the patient comfortable. And after doing that, do aftercare of the equipments and then wash your hands.